Hi guys, it's Kim. It has been a long time since I filmed or posted anything, so I wanted to finally give an update on my occipital nerve decompression surgery that I got at the end of March. I'm 8 weeks out now, and I'm finally feeling just ready and able to film. I haven't been doing weekly updates or anything. I think last time the weekly updates got kind of depressing because nothing really changes from week to week. It just takes longer than that to really see a difference. So I just wanted to kind of wait to post an update until I actually have kind of a sense of how things are stabilizing. Things have been really rough, but I definitely felt more prepared this time around because I had already gotten my trigeminal branch nerve decompression done in December. So this was really my second time going through all of this, which in some ways made it harder because I was more exhausted, but in some ways also provided a lot of perspective. I think if I had gotten my occipital surgery first, I would have thought that this was the worst experience I've ever had. And I would have thought, how could it be worse than this? But because I already had the most awful experience of my life with the first surgery, I think I was just more prepared this time around and had more perspective on the fact that things will get better. I really got lost in the just constant pain of the first couple of months last time around, but this time I really just sort of dissociated my way through it and distracted myself and just really had that perspective of things got better last time, so I know that they will get better this time. So that is why I have not been filming weekly updates, but I'm going to give a rundown now of my surgery, what my surgeon found, and how recovery has been going, how I'm doing now, just kind of summarize everything. And I will also try to post at the 3-month mark as well. I'm halfway to the 3-month mark, so actually I'm over that. I'm 8 weeks out, so I only have one more month until I should be seeing more stable results. So I will definitely post an update in another month or so when I have more clarity on that. But I will just start out by telling you guys how the surgery went and what my surgeon found. My surgery ended up being, I think, 4 or 5 hours long. I had 6 nerves decompressed, all 6 occipital nerves. And my surgeon found a ton of structural damage. I had kind of always downplayed the back and always said, the pain is so much worse in the front. Like, the back is probably not that bad. But the pain in the back was significant, and I'm kind of realizing that now as I'm recovering, and I'm feeling obviously exacerbated pain in the back, but it feels like the familiar pain that I felt for a long time. So the occipital nerve has a really global pain pathway, and I think I knew that on paper and I'd read about that, but now that I'm recovering from surgery and sort of having that exacerbated pain in the back, I really do feel how global it is, because your occipital nerve runs from your neck to the top of your head, but it shoots all the way up and around, and it also goes to your eyes, which is why it's called occipital. So I think a lot of that pain in the front that I was feeling in my eyes and my face, while a lot of that was caused by the trigeminal branch nerves I had decompressed in December, I think a lot of it was also the pain pathway from my occipital nerves. So definitely do feel like this surgery was the right thing to do, and even though I'm not fully where I want to be yet, I have already seen enough results to make it worth it. So I'll get into all of that, but the structural damage that I had going on was really, really extensive. I had blood vessels wrapped around my right greater occipital nerve like a corkscrew, and my right greater occipital nerve was also flattened at one point. It went from being round to being flat, which is obviously not great. Same thing was happening on the left greater nerve as well, and my lesser occipital nerves also had blood vessel interactions and muscle compression and fascia compression. Then he ended up removing my third occipital nerves, so I had a lot of damage going on, and the blood vessel wrapped around the nerves makes a ton of sense given the nature of my pain. I think I've mentioned before, but my pain has always had a very throbbing nature to it, and while I do have dull underlying pain, a lot of the times it would also throb in time with my heartbeat, which made it really, really hard to navigate, because when your pain is related to your heart rate, then the second that you stand up or walk or do literally anything, your pain spikes up. So it makes a lot of sense that I had those blood vessel interactions going on, and I'm really thankful that he was able to remove all of those. So he was able to fix everything, and he was really happy with how the surgery went. I had a really, really terrible recovery from this surgery on day 1. Last time when I woke up out of surgery, I was so out of it, and the drugs helped so much that I really didn't even remember the first honestly like 3 days post-op, which is such a blessing because obviously you don't want to remember waking up from surgery. That's not a fun experience. But this time around, I woke up and it was just really awful. My pain was spiking uncontrollably and I was vomiting. I just felt literally terrible and the pain never got under control. I don't know why. They gave me oxy, they gave me fentanyl, and it just never got under control. So I ended up just going home, still in severe pain. And I had a really, really awful day that first day. I felt every single second of that pain from the first day of surgery, which is not ideal. But from there, it kind of stabilized. I would say the first 2 weeks, I felt like I was getting kicked in the back of the head repeatedly, but it wasn't as bad as the pain from my first surgery. So I was kind of not like I was, doing well, but I was kind of able to have a little bit of perspective on it. The hardest thing though was getting comfortable, and that still is a struggle. Like I still can't lay on the back of my head or put any pressure on the back of my head. I can't even like wash the back of my head. It's so sensitive and so tender. But those first few weeks, it was even worse, and I really, really could not get comfortable at all. I also had a drainage tube for the first week post-op. I'll try to insert a picture of that if I can find it. That made it also just really difficult to get comfortable because I was so afraid it was gonna rip out of my head. So I was wearing a shirt with a pocket and I put it in the pocket and I would try to pull the cord out just enough so it was comfortable to sleep. But yeah, thankfully it didn't pull out of my head. I was really worried that would happen, but it didn't. But yeah, definitely super, super uncomfortable. I ended up sitting up in a recliner most of the time, but even that was not comfortable. I definitely I felt more alert this time around post-op, which is not necessarily a good thing because I think because I've been on gabapentin off and on for, 4 or 5 months at this point. I don't think it hit as hard as it did after my first surgery because when I got my first surgery, I had never taken a gabapentin in my life and then went straight to being on 900 milligrams. And so it worked so well and kept me in sort of a little bit of a stupor, which is what you want to be in when you're recovering from surgery. But this time around, I just felt like the meds didn't work as much and I felt a lot more alert, and I couldn't sleep because I couldn't get comfortable. I couldn't take naps because I couldn't get comfortable. So I really felt like I was awake and alert for the entire recovery experience. I was able to read a little bit and watch TV, watch movies somewhat. The eye pain was not nearly as bad this time around as after the first surgery, so I was able to distract myself a little bit more. But yeah, it was definitely a very long and boring first 2 months post-op for sure. The pain in the back definitely is kind of electrical, kind of shooting, stabbing, which is a lot like the nerve pain after my first surgery felt like, so I was kind of prepared for that. It definitely is not as bad as the pain that I had in my eyes after my first surgery because he cut into my eyelids and he shaved my brow bone in my first surgery, and so that surgical pain was awful and sort of radiated down into my whole face. Whereas this time it's in the back of my head, so it's a little bit easier to kind of distance myself from it. It almost my neck hurts, my shoulders hurt, my back of my head hurts. It's not as debilitating as having that pain be right up front. So I have, like I said, I have been able to distract a little bit more from it. But yeah, I would say the first 6 weeks were pretty rough, and especially the third week. This is kind of the trajectory I had last time as well, where during week 3, I feel like my nerves fully woke up from the numbing and the anesthesia. And so I had a terrible migraine flare that lasted 5 days during week 3, and then I had another pretty bad migraine flare, I think in week 4, week 5. How that works for me is that I have underlying neuralgia, so I have constant pain all the time, but the neuralgia also causes migraine flares. And so having that combination is absolutely the worst thing ever. I will say though, after the first surgery, I had a constant migraine and neuralgia pain probably constantly for 2 months, whereas this time I can point to 2 isolated migraine flares that I had. So definitely easier, but obviously you never want to have a migraine flare. It's never ideal. So yeah, overall it has been easier, but it has still been hard. I'm trying to think of what else I wanted to say. I have felt the the pain that I felt post-op does feel kind of like my old familiar pain. It's definitely exacerbated because the nerves just got manhandled, but it does feel like familiar pain pathway. So it is kind of reassuring that I do think he got the right spots, and I do think the back was playing a way bigger role in my pain than I ever gave it credit for, because the occipital nerve is just such a global pain pathway. It makes your whole head hurt. And so I've had headaches before where it's like, I couldn't really tell you where they start from or what they feel like exactly, but now that I've had the surgery, I realized that it is occipital neuralgia that I was feeling. It just doesn't feel what you would think it would feel like, I guess. Like I would have assumed that it would just be pain in the back of the head and it would be very isolated and easy to identify, but because it spreads so far forward, it goes to your eyes and your forehead and your temples, it definitely feels like a global headache. So that is kind of reassuring to know that, you know, this pain feels familiar. This post-op pain feels, it's worse than normal, but it is a normal pain pathway. So I feel like that's kind of validating to know that it is the right spot. But yeah, I'm 2 months post-op now, so I'll kind of give a little update on how I am doing now. I would say in the past week, I have felt improvement. I wouldn't say significant, but I have felt improvement. It's sort of hard to tell though, because it's like, am I just feeling improved from where I was 2 months ago with just getting my head cut open, or am I actually feeling improved from where I was before surgery? But I would say that I am feeling improved from before surgery. I think the biggest difference, and I mentioned this after my first surgery too, but the biggest difference is that because I had all that blood vessel interaction with my occipital nerves, my pain would have a very throbbing quality to it all the time. And, you know, when your heart rate is related to your pain, or your pain is related to your heart rate, then the second you stand up or walk or do anything that gets your heart rate up, your pain spikes. And now that I don't have those blood vessel interactions anymore in the front and the back, I feel like my pain is a lot more dull and easier to push through. It definitely still hurts all the time, and it hurts significantly all the time, but it is less debilitating than the kind of throbbing, pulsing pain that I was having before, which is why I would always refer to that pain I was having before as migraines, because, you know, migraines are throbbing and pulsing. So it kind of feels like I went from having a migraine all the time to having a really bad headache all the time. And there is a difference between those two things. Obviously, I would prefer not to have the really bad headache all the time, and hopefully I'll get there, but I am thankful to have already seen that improvement. So that's been in the past week or so. I've definitely felt like maybe the swelling and inflammation in the back is going down a little bit, and the surgical pain is kind of lessening. I am currently weaning off of gabapentin. I'm down to 1 a day, and it's going well. I definitely miss it and would prefer to be still taking 900 milligrams, but I don't want to be taking medication for the rest of my life. That's one reason why I got surgery. So I'm just going to try to go down to 0 gabapentin and see what my baseline is. And then if I need it, I'll take it as needed. But besides that, I'm not really on any medications. They did give me oxy right after surgery, but oxy, it puts me to sleep, but it doesn't really help my pain. It did the first time around, but it didn't this time. I don't know why. Maybe I had built up a tolerance or something, but I haven't really been taking that. They gave me, I think, 12, and I think I still have 7 left, so I haven't really been taking that very often. I also have been really using medical marijuana a lot more, because when I had the blood vessels wrapped around my nerves, sometimes weed would make it worse because it makes your blood vessels bigger. But now that I don't have that, I can really, really feel a difference when I take an edible. So I usually do that in the evening to kind of wind down. That helps me sleep. Insomnia has been a huge, huge issue for the past year. I don't think I've gotten a good night's sleep in the past year, but it has been worse after this surgery because I can't get comfortable. And I can only lay on the left side of my head because the back of my head and the right side of my head hurt too bad. So it is really, really hard to get comfortable and find a good sleeping position. So medical marijuana has helped a lot with sleep as well. But I still do have a lot of really bad insomnia and a lot of horrible nightmares. I had the most horrific nightmares. Literally had sleep paralysis, literally saw demons after my second surgery. So that's been really rough as well. but things are starting to feel a little bit lighter. I just feel like the cloud has kind of lifted a little bit. It's very, very, very small improvements, but I definitely do feel like I am already glad that I got both surgeries. I do feel a difference in the quality of my pain, and I do feel like, you know, if I do need to still try other treatments or be on other medications, I feel like they will work better now that the underlying problem is fixed. You know, nerve damage is oftentimes irreversible, so it may never fully get better, but at least my nerves are no longer actively being traumatized, and so hopefully they will start sending fewer and fewer pain signals to my brain. But yeah, things have started to improve ever so slightly. I definitely feel like I have more energy. Some of that could be the weather as well. I do usually feel better in the summer, so that could play a role. But yeah, when I look at the amount of bedridden days I've had each month, it got worse again after my second surgery because I got knocked back down. But overall, like 2 months post-op for my first surgery and now, I noticed a big, big decrease in the amount of days I'm fully bedridden. I haven't been fully bedridden at all a single day in May, I don't think. Or maybe just one day. But it is getting better. I am able to do more things and have more energy and just push through more. I still have a long way to go, but I do already feel like the surgery was worth it. In the past week, I've had pain at a 7 out of 10 every day, which is the lowest my pain ever gets. So it's all relative, you know, like if you'd never had a migraine before and you had 7 out of 10 every day for a week, you would be in the hospital. But for me, because that's the lowest mine ever gets, it feels significantly better than, you know, being a 9 out of 10 pain every day. The difference between a 7, an 8, and a 9 is significant in terms of what I'm able to do in a day. So I definitely am hoping, obviously, that as time goes on, I am able to be in 6 out of 10 pain, 5 out of 10 pain, but for now I will take what I can get, and I am able to just mentally handle the 7 out of 10 because I've been so much worse for so long. So I definitely am feeling like things are stabilizing, but I am pretty early in the process still. It takes 3 to 4 months to see results, and I'm 8 weeks out, so I could have, you know, another 8 weeks before I really start feeling better. I definitely think it took 4 months for the pain in the front to get better. I do feel like the results of my first surgery have kind of settled, and I do feel like my forehead is significantly better. My eyes still hurt a lot because it's coming from the back still, but I'm hopeful that as my occipital nerves heal, that will go down. I do still have a pretty bad spot in my temples as well. But I would say the left side of my head overall feels better, and the whole forehead feels better, but this section here is still pretty bad. So I do still have a ton of progress to make, and I'm hopeful that at the 4-month mark of my second surgery, I will hopefully be more stable. But yeah, thanks for watching. I will try to post another update soon and just keep you guys in the loop a little bit more. I really appreciate all the support and everyone who dropped off gifts or food after surgery. It really means a lot. I have such a good support system, and I really never take that for granted. So thank you for watching, and I will hopefully see you guys soon.